Sleep apnea is a big problem, and what we do is we do an evaluation to determine if a person has sleep apnea. We work with sleep physicians in the area to make sure that we're getting a proper diagnosis of the level of apnea that they have. Many patients we discover have difficulty with CPAP. It's a great product, but it has a lot of wear issues. What's considered CPAP compliance is an extremely low level of compliance. It's actually calculates out to be about 40% of the time that you're wearing it. If you're only wearing your CPAP 40% of the time, the end result is you're really not treating your sleep apnea. So what we do is we work with patients to treat their sleep apnea a different way. And what we do is we have what are called oral appliances. The oral appliances allow us to position the lower jaw in a different place, allow us to relax the airway so we'll open. It'd be sort of like if you took a fire hose and twisted it, and you took that fire hose and put a lot of kinks in it. What would happen is the water would go through that hose in a very twisted pattern, and it wouldn't come out the end of the hose very well. So if we take your airway and do the same thing to it and twist it, what happens is the air becomes very turbulent. It doesn't flow very easily down into your lungs, so it's hard to get the air to where it needs to go. So what we do is we use a technique, which is a neuromuscular technique, which relaxes the airway, takes that fire hose and unkinks it, untwists it, and allows the air to get into the lungs a lot easier. And then we also use a neuromuscular technique to find out exactly where your jaw wants to be to allow the tongue to get out of the back of the throat and be more comfortable for the air to get back down into the lungs. When we do that, the end result is that the apnea goes away. We can treat that apnea and make it so that the person gets proper oxygen when they're sleeping and it doesn't have the negative effects on the rest of the body.